I'm going to be giving direct IV push medications to Elizabeth Bennett. I'm going to be giving her Naloxone, and this is because after my assessment at the bedside, I found that her respiratory status was quite diminished. She is having less than 8 breaths per minute and scoring less than 3 on the sedation scale. So her patient care orders and the MAR indicate from her physician that she will be receiving Naloxone 0.1 milligrams IV stat for her respiratory status. So I'm first going to check the IV monograph and see what it says about Naloxone for all the safety points. So I've opened up to Naloxone in my drug monograph here. I'm looking at contraindications, cautions for cardiovascular disease. Under the administration section, I'm giving it via direct IV, and all registered nurses may give it. I'm a student nurse, so I will be doing some extra steps with an RN's observation. For an adult, I'm giving the Naloxone over 30 seconds, and I'm also diluting it with 9 mL of normal saline. I'm also looking at any monitoring that is required, reconstitution, which is not necessary, and then I'm also looking to see that Naloxone is compatible with normal saline for 24 hours at room temperature. I'm also checking for adverse effects that I may see in my patient, like tachycardia, hypertension, cardiac arrest, hypo and hypertension, VTAC, etc. And that is about it for the safety points for Naloxone from the IV drug monograph. So I'm going to put that off to the side and try and give myself more space here. So to begin, I'm going to do some hand hygiene. And I'm going to take out my supplies. And upon doing that, I will do my first check of the Naloxone and the sodium chloride. So I have Naloxone 0.4 milligrams per mils, which is what is in my vial, and it does not expire until 2035. And then I have sodium chloride 0.9%, 10 mils, and it does not expire until 2022. So that's my first check. And I'm going to prep all my equipment. So I have my 10 ml syringe. I have my 2 posi flushes, blunt filter needle, and my medication label. Come on. Okay. Oh. There we go. So my second check and my 7 rights. So I have the right medication, I have Naloxone, and I'm also looking at the MAR for my checks. I have Naloxone for Elizabeth Bennett. I am giving 0.1 milligrams, or as I calculated in my math, I'm going to be giving 1 ml of the med with 9 mL of normal saline. And I would also confirm my math with an RN because I am still a student. And from my calculations, I will be giving 2.5 mL in my syringe at the bedside, and I'll be wasting 7.5 mL from that 10 ml syringe. So I've got the right med, the right patient, the right dose, which is 1 ml, or 2.5 mL in total for my syringe. Right route, she's getting it via IV direct push. And the reason is because her respiratory status is quite low right now. She's having under 8 breaths per minute, and her sedation scale is less than 3. And then, of course, the right documentation, which would be the 2 signatures or initials on the MAR, and the patient care orders to verify the documentation. And then after I draw it up, I'm going to dot my MAR. So that's all good. Now I'm going to first swab the tops of my vials. We'll pretend that was for 30 seconds. I'm going to aspirate some air into my syringe and then inject that air into the normal saline. And then I'm going to aspirate 9 mL of my normal saline, watching for any air bubbles. Okay, good. So I've got my 9 mils there, and I've got a little bit of air, so I'm just going to aspirate a bit more normal saline and make sure I get that air out. Okay, so that's 9 mils there. I'm going to cap my syringe by sliding it on with my shaky hands. And then I'm going to draw up my morphine, or my naloxone. My 1 mil. And there we are. Now after drawing up this 1 mil, before I take it off of the vial, I'm going to confirm with an RN that I have the right medication amount in my syringe. And then slide my cap on again with my shaky hands. I've filled out my medication labels, so I'm going to pop that on, attaching it to the syringe, not the cap, for safety purposes, because if I lose the cap, then no one has any information on what is inside the syringe. So I've done that, and then I'm going to do my third check before putting these away, that this is indeed still sodium chloride, and it has not expired. It's good till 2023, and that this is naloxone, 0.4 milligrams per mil, and it still has not expired. It's good till 2035. I'm going to put those away. I'm going to bring my sterile swabs, my 2 posi flushes, and my MAR to the bedside. Carried away there, so before I go to the bedside, I need to do my wasting. So as per my math, which was checked by an RN, I am going to be wasting 7.5 mils, and I'm going to do that into the sharps bin. So I'm going to waste my 7.5, and then as I get closer to the 2.5 mil mark, I'm going to go a little slower to make sure I'm accurate with the medication and the contents of my syringe. So there, I have 2.5 mils in my syringe now. Now I'm going to go over to the bedside and do my best filming myself. So I'm now at the bedside, and because of my patient's respiratory status, she likely won't be able to respond. So I'm going to walk over to the other side of the bed for good body mechanics, and I'm going to check her identifiers, that she is Elizabeth Bennett, checking her birth date, her personal health number, and seeing that her allergies are tetracycline, which we're not giving her today. So I'm going to make sure that bed is raised to a good height for me. And I'm going to start by, if her infusion was running, I would clamp it. And I'm going to clean the port for 30 seconds. For the purpose of the video, we'll say that was 30 seconds. I'm going to clamp it there as well. I'm going to have my medication. I'm going to take the cap off. And put that cap in the sharps. And over 30 seconds, I'm going to unclamp here at her site, and I'm going to infuse it. There we go. Clamp that. So I've given her medication. Now I'm going to take a new swab. And I'm going to clean the port again for 30 seconds. And now I'm going to do my flush of normal saline. So first, I am going to hook that up. And I'm going to do, at the same rate, over 30 seconds of giving her the normal saline to flush the medication all through. So again, speeding it up for the video. And then I'm going to push, pause, push, pause, push, and clamp under pressure. I would stay here for about 5 minutes to monitor my patient and see that her respiratory status does improve. And then from there, I would document on my MAR and sign off that I have given her this medication. And then, of course, safety pieces, lowering the bed, making sure her call bell is in reach.